The roles and settings that speech pathologists work in for treatment of patients with dementia. We work in many settings, medical settings such as hospitals, rehab clinics, and long-term care facilities. We also work in private practice and in home health. We work alongside a lot of other professionals, and interprofessional communication and teamwork is very important when working with dementia patients. We work alongside occupational and physical therapists, alongside neurologists and psychologists. We also work with audiologists, like mentioned before, when assessing their hearing to determine whether it's a natural process of aging or if it's dementia. We also work collaboratively with other SLPs and also the family and caregivers of the patient. Dementia has a lot of impacts on communication, most notably the ability to process information lessens over time and with the progression of the disease, so response time can be delayed. Overall comprehension is impaired as the disease tends to progress. As listed on the Global Deterioration Scale, overall comprehension is impaired. Therefore, it can impact their ability to respond and communicate with us. And expressive language can be impacted by the inability to word find, recall, and access their episodic memory. So, like we talked about with dynamic assessments, to assess their episodic memory and their story recalling abilities, it's important to assess that with communication to know what kind of vocabulary and word finding abilities that they have. And then many intervention strategies include visual and written cues, written schedules and lists, memory and communication aids, increased object naming, using phonemically or semantically based word strategies, and incorporating patients' interests and hobbies when appropriate. All of these in intervention are really important, especially when the disease is progressing. It's important to have solid intervention strategies and naming strategies that can be used as it progresses to help preserve their memory and communication abilities.